Hi, my name is Rocky Yap. Hello, everyone. Welcome to our meeting. This is a meeting sponsored by the DuPage County Medical Society and in collaboration and partnership with the DuPage County Department of Health. So we are so grateful that all of you have joined us and here with us today. We have some outstanding speakers today. And before I introduce them, I want to just say a few things on behalf of our department. We have, on behalf of our medical society, the medical society is one of the oldest medical societies in the state, and it has been doing programs on behalf of physicians for over 100 years. And it's an organization I'm very proud to belong to, and the accomplishments over the years have been numerous. I want to introduce a couple of our key leaders. I don't know, Lanny, are you able to, can you hear me right now?
Yes, I sure can, Rocky.
Okay, so I want to introduce Lanny Wilson. He is a past president and chair and really one of the moral and intellectual leaders of the DuPage County Medical Society. He's also been an outstanding director of our Governmental Affairs Committee, which has been just an unbelievable organization. I want Lanny just to tell us a little bit about what they're doing before we get started. And Lanny, please take it away.
Thank you so much, Rocky, for that kind invitation and introduction. The Governmental Affairs Committee of the DuPage County Medical Society has been ongoing for about 20 years now, Rocky. We meet monthly, as you know, and they're kind of like fireside chats without the fireplace. We meet with local, state, and national legislative leaders, talk about all kinds of wonderful issues, from the heroin opioid issues, of course, the present COVID-19 issues. One of the more interesting discussions we had just a few months ago was one-payer insurance systems versus traditional insurance, domestic violence, telemedicine. Rocky, we talk about a whole bunch of issues that are important to medicine in Illinois and America today. We are fiercely nonpartisan and advocates for all physicians. We would love to have anyone out there, even if they're not members of the society, join us. You have to be a member of the medical society to become a member of the committee, but we welcome the public and would love to have as many people join us as possible at those meetings. Thank you.
Well, Lanny, thank you very much. And Lanny, I want to emphasize again, Lanny has just been a spectacular leader in meeting with so many important, not just physicians, but so many political leaders that help develop health policy, not just in the county, but in the state and sometimes nationally. So Lanny's been an outstanding leader in the DuPage County Medical Society. And I would, if you're interested in joining our organization and interested in being involved with some of the things Lanny is doing, I encourage you to join. It is it's really just fascinating with some of the things we do with our political leaders. Larry, are you on?
I'm on.
Okay, so Larry, something is Larry's been a past president. He has been a chairman of the board, and he has been also an outstanding leader. He is a physician at CDH, and he's also become a great friend of not only myself, but everyone who's involved with the DuPage County Medical Society for his leadership. And I just want to give Larry a quick chance to say some things about our organization. Larry, go ahead.
Well, yes, I just want to tell everyone how pleased we are to offer this presentation to our members and non-members alike. And for our non-members, I want to sincerely thank you for participating. I also want to sincerely ask you to please consider joining our membership. Your county medical society represents and advocates for physicians and our patients. Whether you're a member or not, we represent you and advocate for you. As we form our policies and plans, we'd sincerely like to have your voice as part of our organization. For those who don't know this, your county medical society supports education programs such as this, philanthropy. We have a foundation that provides scholarships to healthcare students. Of course, we advocate on behalf of physicians and our patients. We meet legislators quite often. I've been told once, and it's so true, if you're not at the table, you're on the menu. And we like to have our physicians at the table when it comes to discussing policy on behalf of physicians and patients. And a very important aspect of the DuPage County Medical Society is social engagement. We've had some very wonderful mornings, Saturday mornings at the Illinois Food Bank. This past year, we've had virtual meetings, but soon we'll be getting together again for what we call our physician lounge events, where we get to know each other, learn something, and basically have fun. You know, our physicians, you know, we all know our colleagues, we know people at our office, at our medical group or hospital, but we don't know the physicians in other parts of the county. I can tell you that it's been the greatest joy of mine to be able to meet some of the people you've heard tonight and you'll hear, and just get to know them at a different level. Hopefully there'll be a screen later on where you can see information about joining the society. We have an introductory annual dues for the beginning, certainly affordable. So I'm just asking you, please consider membership, and thank you for your time.
Larry, thank you very much. We're going to start the guts of our meeting, if you will, right now. And just to let everyone know, we're going to have a question and answer session after our three esteemed speakers speak. There is on the bottom of your screen, there's a Q&A section where you can click on and put your questions in, and we'll try to get to all of them. So please, we encourage you to ask questions if you have any. We have, as I said, three speakers, really just superstars, I think, as physician leaders in our county, and we're so honored to have them here. The first one I'll introduce is Rashmi Chugh. I think many of you heard Rashmi speak last month when the pandemic vaccine was just coming out, and she gave a great talk then. And we asked her to come in again and give an update from the DuPage County Health Department. She's also a member and an important leader in our DuPage County Medical Society. And I don't know, maybe you may not know Rashmi, but if you do, you're lucky because she's an outstanding leader. She trained, I've known her since residency at Hinsdale Hospital, and she's gone on to become an advocate not only for physicians in the county, but she's been an advocate for patients across the county. So I'm very proud to call her my friend, and would like Rashmi to take over our first speaker. Rashmi, go ahead.
Thank you so much, Rocky Yap, and thank you to Dr. Wilson, Dr. Scouten, and Dr. Yap for leading us, the Medical Society during these times, and thank you also for the kind introduction. And Kate, I think you're bringing my slides up, correct? There we go. I see something happening.
Yes, she is.
Fantastic. Maybe from beginning at the top left. There we go. Excellent. Thank you very much. So yes, good evening. I'm Rashmi Chugh. I serve as medical officer of the DuPage County Health Department and a humble and proud, if that's possible, past president of the DuPage County Medical Society. Yes, providing kind of a follow-up presentation and status update of COVID-19 vaccine and vaccination in DuPage County. Next slide, please. So really at the county level, I mean, I speak on behalf of our executive director at the health department, Karen Ayala, and our entire team, that it's been quite a 2020, and we're so fortunate now that we're at the point that we've been awaiting for so many months, where we have not only a vaccine, but more than one vaccine. So that's exciting, but as we know, vaccines do not save lives. It's vaccinations that save lives. And that's a quote that's been appropriately restated many times, that originated from Dr. Walter Orenstein, currently Emory University infectious disease researcher and former U.S. Immunization Program Director at CDC from, I think, 1988 to 2004. I had the privilege of hearing him speak live at a training session in 2005 when he had just left CDC and gone to Emory. But yeah, it's a simple yet profound statement that it's vaccinations that save lives. We need to get these vaccines into people's arms. Next slide, please. And this slide really shows that we have our work cut out for ourselves. With influenza vaccination nationally, as well as by different minority groups, we are at best approaching 50% in recent years as far as vaccination coverage levels. So at least the trend lines are moving upward, but we really need to we need to think outside the box, and we need robust strategies to increase demand as well as uptake of COVID-19 vaccines. And this slide is actually from October during vaccine planning, but we fortunately now have vaccines available. So we need to far exceed the 50% that we achieve with influenza, if that. So next slide, please. So we have a novel organism in SARS-CoV-2, and it's a relatively new pandemic. I mean, considering, and it's we're fortunate to have multiple vaccines currently, and with the current vaccines being approved for 16 and 18-year-olds and older, it is largely an adult-focused platform, which is very different from most of our approach with our traditional approach to the vaccines, where it's the primary focus is in early childhood. So we understand that there are concerns. Not only will have, but we know that there are concerns. Some are based in myth and misinformation. Some are based in real cultural and life experiences. So it's very important to address these concerns with empathy and transparency. It's also very important that we as healthcare providers, as physicians, physicians and clinicians are really the most trusted source for health information. So we want to make sure that we ourselves are able to address concerns and make sure that we build confidence among ourselves to be vaccinated, and then to strongly convey and recommend strongly convey the recommendation for COVID-19 vaccination among our patients, as well as our colleagues and our coworkers and our friends and family in our community at large. I think, many people, most people, I would say, look to physicians for their take on it. Like, what are you going to do? Are you going to get it? And we want to make sure that we, with confidence, can say, yes, I'm going to get it. Or many of us, I think, are fortunate. I think I'm getting mine later this week. But I think many are already fortunate to say that they've gotten it, or that they've gotten one and they're about to get their second dose. So I think that it's very important to share those stories and share your confidence in the vaccine, specifically with regard to the safety and efficacy of the vaccine. And finally, not only on an individual basis, but it's important for us in medicine and in public health to engage with community organizations and leaders, not just within medicine, but within the faith-based community, as well as different cultural communities and school communities. And so it's really an opportunity to frequently communicate clear and accurate information on COVID-19 vaccines. Next slide, please. So this strategic framework from the Centers for Disease Control and Prevention is really their approach toward vaccination in general, to vaccinate with confidence. It kind of flips the conversation from vaccine hesitancy, which is important to address. We want to make sure that we're specifically identifying and addressing concerns, but not maintaining our focus there. We want to, like I said, flip the conversation and really talk about what we do believe, what we do know, and what we can improve. So one is to reinforce trust, to build trust and reinforce trust. And again, regularly communicate clear and accurate information and build trust in not only the vaccine, but in the vaccinator and in the overall health system, public health system and health system more locally. And then also important to empower healthcare providers, again, so that healthcare personnel are making the decision to get vaccinated and then make that strong recommendation to patients and beyond. And then making sure that we're engaging communities as well as individuals in a sustainable, equitable way and inclusive way, bidirectionally, actively listening. I heard a term recently about eloquent listening, and I thought that was kind of profound, because we want to make sure that we are understanding concerns that are communicated to us so that we can better address them toward increasing collaboration and building trust in the vaccine. Next slide, please. So they've basically customized the framework to vaccinate with confidence toward COVID-19 vaccines. So again, very important to build trust through clear, complete, and accurate messages about COVID-19 vaccines, taking very visible actions to build trust in the vaccine, the vaccinator, and the system at every level. And then really the focus here, given particularly that we're in phase 1A, and also that the recommendation and conveying that confidence begins or sometimes ends, unfortunately, but we want to make sure it flows from the clinician and physician onward. So very important that we empower healthcare personnel by promoting confidence among ourselves in our decision to get vaccinated and to recommend vaccination to our patients. And again, our individual, our own circles, whether it's professionally and socially and in our communities. And speaking of that, then also engaging communities as well as individuals. Again, we want to make sure that we're providing information at appropriate literacy levels, as well as linguistically and culturally accessible and in an inclusive way as possible. Next slide, please. And specifically, CDC provides these strategies to build vaccine confidence among healthcare personnel. So one is certainly, and we've seen a lot of this, I think, from Dr. Anthony Fauci to, other national and state and local leaders to be vaccine champions, to model healthy behaviors, including, to get vaccinated, to wear a mask, and, to physically distance and practice those behaviors that we know can help to mitigate COVID-19 transmission. So we certainly would like senior leaders to lead by example and serve as vaccine champions. Also to make sure that we are hosting conversations and discussions such as this forum, I think, to provide input and ask questions. And this is an excellent forum, certainly to communicate among ourselves, but we want to make sure that we're having conversations in multiple settings. Better to be redundant and make sure that we're having customized forums and conversations that, again, not only address concerns, but invite sharing of those questions and concerns. Very important to share key messages with staff and through multiple modalities so that they're also armed with talking points and with understanding so that they can effectively communicate messaging about safety and efficacy. And speaking of that, very important to educate healthcare teams about COVID-19 vaccines, about how they're developed and monitored for safety. We'll talk briefly about that, and then how teams can talk to others about the vaccines. And even beyond our healthcare teams, very important to educate non-medical staff about the importance of getting vaccinated. As we know, the definition as CDC defines healthcare personnel, it's really an umbrella definition that covers anyone who's in and out of a healthcare setting, whether it's on a daily basis, an outpatient basis, whether it's in a long-term care setting, whether it's in a or another congregate care setting, or in the inpatient setting. So we want to make sure that we're addressing those who provide direct clinical services as well as indirect services, and who may be at risk of exposure or introducing infection in these settings by different modalities. So bottom line is that we need to make the decision to get vaccinated visible and then celebrate it. So it's been really heartening to see so many individuals, just general lay persons, but actually more so now because we're in phase 1A, it's really been a lot of healthcare personnel and many long-term care facility residents who have had publicly in the media, they've had photo ops, but even in social media, there's been a lot of sharing that's been really inspiring and heartening to see folks posting, either the moment where they got their vaccine or just after, with their sticker that they got vaccinated. So we would certainly encourage and promote those kind of behaviors to, like they say, to celebrate vaccination. We're so fortunate that we're given the circumstances that we're at this juncture. It's a major turning point, and really inspires optimism. Next slide, please. So given that we have the vaccine, it's not, at this point, it's not the be all end all. We know that it's one of the tools in our arsenal to fight this COVID-19 pandemic. So at this point, and you'll see shortly that, we're just as of today, we're at about 1% of the DuPage County population being vaccinated, but so clearly that does not mean that we can stop masking or physical distancing or anything like that. We need to get vaccinated. We need to get as many people as possible vaccinated. But we also, for the foreseeable future, need to continue the measures that we know work to reduce transmission, such as universal masking, and staying, at least 6 feet away from individuals not from our household, as well as practicing good hand hygiene, and really at this point of still avoiding in-person gatherings. We still have a very high level of community transmission, and we're still well above the peak that we experienced in the spring. So, so again, we want everyone to get vaccinated, but we need for now to continue to comply and actively participate in the other mitigation measures and containment measures. We still need people, if they're ill or infected, even without symptoms, we need folks to isolate for the 10-day period. And then if they're a close contact, if they've been exposed to an individual with COVID-19, we still need close contacts to stay home and self-quarantine for 14 days ideally. And so those are the measures that we need to continue to promote and implement. Next slide, please. So as I said, we're so fortunate to be at this juncture where it was, I think, December 16th, where we received our first batch of vaccine in DuPage County, and then the first vaccination started on Thursday, December 17th, and then those were all very much hospital focused, and then it was the following week on that Monday, December 21st, when we started, on a limited basis, and now over 300 doses a day at the DuPage County Health Department, mass vaccination clinics. So two vaccines, each provided in 2-dose series, are being administered, and they were so fortunate that they're both, at least in their trials, they had very high efficacy. We anticipate this going forward. 94, 95% effective. Again, both are offered in 2-dose series. The Pfizer vaccine has a 21-day interval. The Moderna vaccine has a 28-day interval. There are some logistical challenges with Pfizer that most hospitals and many other sites, including the health department and other locations, DuPage Medical Group, have been accommodating vaccine supply and storage with ultra cold storage, which is a prerequisite for being able to receive Pfizer vaccine. And then Moderna vaccine does, it's a little bit logistically easier because it just requires standard freezer storage. And then both of these were authorized by the FDA and also approved by, the recommendations were adopted by the CDC in December. Next slide, please. So as we saw, we're currently receiving 2 vaccines, and already in less than a month, we have nearly 30,000 doses administered in DuPage County, throughout the hospitals as well as the health department, and a growing number of provider sites. We have over 7,000. I think as of earlier today, we're at 9,000 even. People being fully vaccinated with 2 doses being completed, since we're just now in the 4th week. So those who were receiving it from the December 17th date onward are now getting their 2nd dose. Also just launched yesterday afternoon is the Illinois Department of Public Health dashboard to track vaccines administered. So it really has quite a bit of information. The vaccine, it's not only statewide information, but you can also track county level information. And if you select DuPage County, you'll see, for example, a graph on the right. You can you can select the graph to be shown with daily dose data or cumulative. And this is a cumulative graph. So you'll see overall the significant uptick in vaccine administered, as well as at the bottom, it's a little faint, but you can see the 7-day rolling average of vaccine administered on a daily basis county-wide. And then we continue to work to expand the number of sites who are receiving vaccines. So again, it started with the hospitals and the health department, and now we already do have a couple of pharmacy sites, as well as some outpatient clinic sites. Next slide, please. So here's the flow, the way the vaccine is allocated and released, federally allocated to Illinois, and that's on a weekly basis. And there's been a fair amount of, I would say, significant amount of uncertainty throughout the process that is somewhat more stable now than it was, say, a month ago, but nonetheless, but this is the flow, and it has been flowing, so that's a good thing on a weekly basis. So there's the federal allocation from the federal to the state level allocation weekly, and then the Illinois Department of Public Health allocation to the county level. And so we receive a county level allocation. Initially, it was shipped in the coordination of even transport of the vaccine was through us, but now fortunately vaccine is being delivered and shipped directly to the provider sites. And then we at the health department maintain this air traffic controller role to help coordinate who's receiving how much and when, and making sure that everyone's prepared to receive it, so that you don't have vaccine that requires ultra cold storage, sitting on a dock somewhere on a weekend if there's nobody there to receive it. So then from or through us in coordination, it's received by vaccine providers. And then here on the right, you see the variety of vaccine providers. Right now, it's mostly in hospitals and some at the health department, some outpatient providers, some pharmacies. We're excited that it's now we have FQHCs that are starting to administer vaccine. And then soon, as we enter phase 1B that we'll talk about a little, that will also be administered on, we anticipate having vaccine provision and administration on site through large employers as well. And I do want to give a quick shout out. I know Dr. Margaret Kierkegaard, one of our esteemed DuPage County Medical Society members and a dear friend and colleague for many years, is on the webinar, and she's been working with the health department for almost a year as a medical consultant, and has been really helping us at the health department to facilitate these conversations and partnerships with our hospitals and health systems. So thank you, Margaret, for your support and expertise in moving us forward through this sometimes challenging but often gratifying journey overall, and with COVID-19 vaccine distribution. Next slide, please. So we talked a little bit about efficacy, and safety is another critical component. And so certainly through the trials and through the approval or authorization initially and approval process, the vaccines were thoroughly researched and vetted for their safety. And then, I mean, that's just pre-authorization and approval, but then now that it's being administered, the safety monitoring doesn't stop. It certainly continues. And the VAERS system, or the Vaccine Adverse Event Reporting System, is a longstanding established program that is a mechanism for providers as well as patients, or really anyone who is concerned about an adverse event, to report that. We encourage reporting. Particularly if it's any reaction beyond the, the relatively mild to moderate, more commonly reported and anticipated side effects post-vaccination. Next slide, please. And there's a pretty extensive system, or several monitoring systems of several different populations. So we just talked about VAERS, and then vSafe is a new smartphone-based system to have, basically an app where individuals, once you're vaccinated, then you're invited to sign up, and then you receive regular, alerts and questions, and you're able to check in and report how you're doing at various intervals post-vaccination. And so those are kind of ongoing and recommended early, and then there's long-term monitoring as well by a multitude of systems here. Next slide, please. So just to understand the prioritization, these are recommendations that have been initially considered and then voted on by the Advisory Committee on Immunization Practices. They make their recommendation that is then adopted by Centers for Disease Control and Prevention. And so those are the phase 1A, 1B, 1C, and phase 2. I mean, it's really phases 1A, B, and C that have currently been adopted by CDC, and then now are being further basically implemented, but with some local state level refinement by the Illinois Department of Public Health. Next slide, please. So what we have are in phase 1 are, as we know, we're in the middle of phase 1A. The target or priority groups are healthcare personnel, and that's in inpatient hospital settings as well as non-hospital or outpatient and congregate care and other settings. And then long-term care facility staff and all residents. And actually there's been a federal program, the Pharmacy Partnership Program, with Walgreens and CVS, where that we're fortunate that through this contractual relationship and this partnership, on-site vaccination is being provided to, I think, 99% of long-term care facilities, particularly the skilled nursing facilities and assisted living facilities in Illinois. It's a national program, but I know in Illinois they've had very high uptake, and I imagine we might hear a little bit more about that in a minute from Chet. And so we're very fortunate to have active participation in that opportunity in the state of Illinois. And then there are other congregate care staff and all residents who are targeted as priority groups in phase 1A. And then in the coming weeks, we anticipate moving to or transitioning to phase 1B, which initially through the CDC was approved as persons aged 75 years and older, but recently IDPH, really out of evidence to address racial and ethnic health equities, or actually health inequities, and toward improving health equity, since the average age of Black and Brown individuals who die related to COVID-19 are younger than 75 years of age. That's actually the case in DuPage County as well. So the age for phase 1B or the age-related recommendation was brought down to 65 years. And then I think I heard just yesterday that or at least at the federal level, they're recommending the same shift. And then frontline essential workers, as well as correctional facility staff and other, are considered part of congregate care staff. And then inmates are certainly included within phase 1B specifically. And then phase 1C are to include persons aged 16 to 64 with high-risk medical conditions, as well as other essential workers not initially addressed in phase 1B. Next slide, please. And here we have a breakdown by population with the estimated size in DuPage County. So these are based on a combination of census data as well as labor statistics. And so we have for phase 1A about 58,000 broken down into 43,000 of healthcare personnel, and then 15,000 is an estimate. It's probably a little bit lower, but an estimate of residents in long-term care facilities and congregate care settings. And then 1B is estimated to be a total of 268, so over 250,000 broken down by frontline essential workers, as well as those persons 65 and older. Next slide, please. So here we have a slide that shows how, from CDC, that shows how we anticipate progressing through the phases. There won't be a discrete endpoint and then beginning point of the next phase. There will be overlap, and we anticipate each phase taking several weeks, and we know that because we're probably more than halfway through our, or we do believe we're more than halfway through our healthcare personnel, phase 1A vaccination, but not quite ready yet to transition to phase 1B, but we do anticipate transitioning in the coming weeks. And then similarly, phase 1B will likely take about 12 weeks. Again, it's still very fluid, but and then we'll eventually move into phase 1C and then phase 2 with everyone beyond that who's eligible and who's receptive. Next slide, please. And again, transitioning, it's there are a lot of moving parts, but it's important to consider demand before moving on. That if demand is still very high, then that's not a good time to move on, because we won't be able to satisfy the individuals in the current group, which is currently the case for phase 1A. We still have, thousands of healthcare personnel who need their first doses, much less, completing their second dose, but we're moving through them, I think, especially as we expand capacity. So, so we want to make sure, for example, current demand is being satisfied, and then that the supply is increasing, supply as well as vaccination capacity with increased provider sites, and then also making sure that we're that we've successfully vaccinated at least 60 to 70% of the current phase. Next slide, please. So currently we've administered over 27,000 doses in DuPage County through the collaboration of all of our hospital and health system partners. And we have ongoing vaccine that is being allocated and transported to our various sites. We have vaccine clinics through the health department where over 1,500 doses are being administered per week. And expanding availability and access through a variety of sites in the community. And we would like to, again, continue to expand capacity, and we'll continue to provide updates. So next slide, please. So just since we're in phase 1, I want to talk through this quickly, that we want to make sure that, again, healthcare systems as well as public health, and we're actively doing this. Margaret is really helping to facilitate these conversations, as well as our, just our hospitals and our health system partners have been very engaged, and also wanting to provide not only for their own on-site healthcare personnel, but also we have a very significant population of healthcare personnel in DuPage County, just like everywhere else, who may not be affiliated or connected with a hospital or health system, but clearly, need to be vaccinated. So we're working through logistical challenges to be able to expand capacity throughout the community. And also important, given anticipated side effects, a good idea for healthcare personnel to have staggered vaccinations so that, an entire unit or, everyone in one department isn't vaccinated the same day, and then 20% need to, aren't feeling well enough to work perhaps. And so good to stagger those. And then also, if possible, good to plan vaccination, particularly for the second dose when, it may be on a Friday, or, when they might have a couple days to recover or lay low. And so there has been some guidance that we'll go through quickly in a minute that is specific to how to discern systemic symptoms versus focused respiratory symptoms, and how to determine, in this age when everyone's symptom screening and symptom monitoring, as well as pre-shift and mid-shift screening in healthcare settings. When is someone, referred for evaluation and testing for COVID-19 versus when is it thought to be related to post-vaccination side effects? Next slide, please. So there is guidance for healthcare personnel, and then what's pending or what is imminent is guidance for example, persons in phase 1B. So these resources are quite excellent. This first link is, I would strongly recommend for any person. It's similar, but this one is for Pfizer, and then subsequent to that, there's one for Moderna, but just really helpful information to help familiarize yourself so that you yourself are comfortable with it, and then you can recommend it to patients and colleagues. The vaccination communication toolkit, particularly for health systems, also has a variety of resources, whether it's fact sheets or social media messaging or slides. Some of this material included here in this PowerPoint, which you'll receive, is drawn from that communication toolkit. And then the post-vaccine considerations for healthcare personnel talk about what to anticipate and recognize. And so we'll move on to that information. Next slide, please. Whoops. Are we on 22 maybe? There we go. So here we have, there we go. Thank you. So there are systemic symptoms that are common in addition to local symptoms, but the systemic signs and symptoms such as fever, fatigue, and headache can occur post-vaccination. Most of these symptoms are mild to moderate. They occur within the first 3 days, counting the first day being the day of vaccination, and then the subsequent 2 days within which side effects resolve typically, and with most occurring the day after vaccination. And yeah, they typically resolve within a couple of days. And interestingly, the more frequent and severe reactions are following the second dose and among younger persons, or those under 55 years of age. Respiratory symptoms such as cough or sore throat or loss of taste or smell are not consistent with post-vaccination symptoms, and instead may be symptoms of SARS-CoV-2 or another infection, and then that would be something to consider for further evaluation and testing, diagnostic testing. Next slide, please. And it can be challenging, and what we don't want is to unnecessarily disrupt workflow, but we also want to make sure we're not unintentionally exposing or inadvertently allowing healthcare personnel with SARS-CoV-2 to work. So that's why it's important to identify strategies to screen individuals and, you know, have internal awareness of who's been vaccinated, like individual awareness, and then also of occupational health, or, you know, at a supervisor level, understanding of who's been vaccinated and what, you know, to provide some context that really, if a person hasn't had a known exposure, and if they're experiencing mild symptoms, systemic symptoms, and are not experiencing fever of 100.0 or higher, then they may continue to work and still be symptom monitoring and all. But if those symptoms persist beyond 2 days, or if they develop a fever or respiratory symptoms, then they should be self-isolating and then being evaluated and diagnostically tested for SARS-CoV-2 and potentially, you know, influenza or other infectious diseases. Next slide, please. Here's some information or a website. There's actually there's a link at the bottom that provides more information about not only at the top, you've got information for patients as well as healthcare professionals, and then a couple links there specifically for patients. Next slide, please. We are awaiting some information, as it says at the bottom. Illinois Department of Public Health will be issuing a siren, or, you know, an alert soon with specific provider recruitment information for anyone interested who's not already enrolled to be able to provide vaccine, and, you know, to patients or to your staff. And there's a process to apply and be approved and register through iCare, which is Illinois Comprehensive Automated Immunization Registry Exchange. And then you also would need to complete a COVID-19 vaccine provider agreement. And that's basically where you're committing to follow the appropriate prioritization, and you have training and equipment to be able to handle and store and ultimately administer, as well as monitor and report, you know, comply with monitoring and reporting requirements related to vaccination. Next slide, please. And finally, this is our DuPage County Health Department COVID-19 vaccine page that we recommend you check out. And there's an arrow there on the right to the section where you can click on that and then sign up for our weekly updates. We recommend that because it's not only will you receive weekly updates. I believe it's on Friday afternoon that we're currently sending them out, but it's also a mechanism by which, as you sign up, you can select your role or sector, and then as we progress through the phases, then we'll be sending out communications overall, but also by role and sector to inform individuals about upcoming appointment availability, whether it's at the health department or at a community provider site. Next slide, please. So thank you for your attention. And I shared a link at the bottom there that you'll see in the slides will connect you to our most recent weekly update. And it's the newsletter that you sign up for. Those go on Fridays, but on Wednesdays. So today was our most recent release of the press release weekly update. So with that, thank you for your time and attention. And I think I'll turn it back over to you, Dr. Yap, and we'll hear our other excellent presenters. And then I think that's when I'd be happy.
We have questions. So Rashmi, thank you so much. I think, can you hear me? I'm just, Rashmi,
yes,
can you
hear
me? Okay, good. Okay, so thank you so much. Dr. Chugh, there are reasons that DuPage County is doing so well, and it's people like you. So really, thank you so much. Just a couple points. What we'll try to do after we're done with this talk, I think Rashmi gave us some wonderful information. We're recording this meeting, so we'll try to have this on our website at the DuPage County Medical Society's website, so you can watch this and spin through a lot of the very valuable connections and links that Rashmi gave, and we'll also try to have that on our website so that people who are interested in going directly to those websites, you'll be able to do that. So before I introduce my next speaker, I just want to make sure everyone realizes this is a CME event. So those physicians who are online, who want to get CME for this, I want to thank AMITA and Mike Eckers, who is AMITA's CME coordinator, to make this possible. AMITA has been a wonderful partner with the DuPage County Medical Society in providing a CME event for this really good conversation. Our next speaker is a friend of mine I've known for years, I guess coming up almost on 20 years. Chet Robson is I met him years ago when he was struggling away as a physician in LaGrange and Hinsdale, and for some reason he decided not to pursue his professional golf career and stayed with medicine, and he went on to get his degree his degree at Dartmouth, I believe, in medical health, and he is and then he went on to continue to practice medicine, but then became the chief medical officer for Walgreens and is helping Walgreens coordinate their response to COVID, coordinate the vaccine. And Chet is not only an important leader in DuPage, but he's becoming an important leader throughout the country because of his work with Walgreens. He's homegrown in our county, so we're very proud to claim him as one of our own, and we're very grateful that he will join us for this meeting and talk about the COVID vaccine from a Walgreens perspective. So, Chet, are you on?
I am. Thank you, Rocky, for the generous introduction. I'm going to get my screen set up here, hopefully.
So, Kate, if you can get his slides up. I think Kate or Chester, you can do that? Okay, good, perfect. We see it, Chet. Go ahead.
There we go. So first, I wanted to say thank you, Rashmi, Dr. Chugh, for the work that you're doing. We work with departments of health at the state level, at the county level, at the municipal level across the country. And I can tell you the incredible work that they're doing, the incredible amount of pressure that they're under. Unfortunately, many of them are in this juggling act between politics and medicine on a whole number of different levels. There's variations between states, between counties, between municipalities. We've seen it here in Illinois, between the state of Illinois, between Cook County, between the city of Chicago. They have a very challenging job. And the other thing to remember is they're doing all of this pandemic work on top of all of the other regular work that they do. So if you've not hugged your public health medical director lately, when it's socially distantly appropriate, I really urge you to do that, because the work they are doing is just phenomenal. A lot of what I'm going to talk about very much just echoes what Rashmi's talked about. As Rocky mentioned, I'm the Chief Clinical Officer for the Walgreens Corporation, both in the United States and in the UK. So we've been looking at this from both a national perspective as well as a European perspective. We are very fortunate to be able to work with some consultants for vaccines. We work with Dr. Dan Baruch, who is the head of vaccinology and infectious disease at Harvard. He was actually the one who's developed the Janssen vaccine. We'll talk a little bit about that. So I can show you a little bit of the inside there. So we're going to talk a little bit about what the vaccine is, where you can get it, what Walgreens is doing, some of the resources, although Rashmi showed you some really excellent ones. And then again, just appreciate being here. Much as what Rashmi talked about, there's 5 vaccines that are currently into phase 3 trials. 2 of them, as she mentioned, have already been adopted here in the United States. They're both messenger RNA vaccines by Pfizer and Moderna. The primary difference is that the Pfizer one can go down to age 16. Moderna is 18. They both have extremely strong efficacy, at least in the trials. And of course, we know as that gets out into the general distribution, that will change some, but it's still a very strong vaccine efficacy. As she mentioned, there's 2 doses. One's 21 days, one's 28 days. The duration of immunity is still being studied because these are new vaccines until we are able to actually have people vaccinated and study it. So clearly what's going on now is the phase 4 studies with the initial study population that will continue to go on, and we'll be able to see, what that has. She mentioned the difference in storage. There's also a difference in diluents. In one needs saline, the other does not. None of them contain any of the common allergens in a vaccine, and the side effects are very much the same in all of them. The AstraZeneca one has been approved in the UK and is being delivered now in the UK, which is why I included the information about it, because we do have the PIs to be able to look at to see what they approved for in the UK. It's a viral vector vaccine, which is more typical of the types of vaccines that we are more commonly used to. It's pretty standard, same thing with 18 years old, 2 doses, and similar to the others. You actually can't freeze the AstraZeneca one, so it makes it much more easy to transport. In the United States, it's not been reviewed, or it's only been partially reviewed because they were not satisfied with some of the data from the studies. They wanted better efficacy data before they could, so they're actually extending part of the phase 3 study to be able to bring some stronger evidence back to the FDA. So we don't expect that we'll be seeing that vaccine probably for another month or so. The Janssen vaccine that I mentioned is the product of our consultant. Because the studies have not been finalized, we can't share any data about that or with the Novavax. But I can tell you that, because this is public knowledge, that it is a viral vector vaccine. Again, it's for 18 years old. They're doing actually 2 lines of study. The first one is only having 1 dose and what the level of efficacy is. They're also doing an arm that is a 2-dose arm. And the 1-dose arm will actually be completed ahead of the 2-dose arm. So we'll have to wait and see. Probably within the next week or so, they will be at a point to be able to report that out. We're kind of all anxious to see what that will show, because again, that will allow now a 3rd vaccine to begin to be distributed here in the United States. I can't find my pointer here. There we go. I'm not going to go through all of this. This is a great reference, though, again from the CDC, that talks about the conditions and how you should proceed to vaccinate. All of you have great experience with vaccines, and so the knowledge you have from giving vaccines definitely applies. There's a tendency to think of this as being a new vaccine, so people get anxious about. But the basic premise of how vaccines work and what they do and how we deal with them is pretty standard. The conditions, though, if you have immunocompromising conditions, pregnancy, lactation, can definitely be vaccinated. You still would observe them for 15 minutes like you would do to others. For allergies, if you have allergies to oral medications, to foods, to environmental, to latex, you can still be vaccinated. You might want to observe some of these people a little bit longer, but they can still be definitely vaccinated. The next column, the yellow column, then, if you have some moderate to severe illnesses, then you probably need to monitor people for a little bit longer. If you have a history of immediate allergic reaction to a vaccine or an injectable therapy, again, it's not a contraindication, but you probably want to observe them for a longer period of time. And then the last category, it's really contraindicated, is if you've had specific reaction to this vaccine, then you really need to have an allergist or an immunologist evaluate the patient to see if they should have their second dose of vaccine or what kinds of conditions you would consider that under. The guidance that Rashmi shared, I would very much encourage you to go and take a look at that, because it goes through all of these in a lot more detail that, than the time that we have here right now to do that. So. And similar to what Rashmi talked about, one of the things that's been interesting during the pandemic, especially for those of us in medicine, is that we can see the science evolving. We can see the research evolving. We can see from week to week, as we get more information, we can greater define and be even more robust in our treatments, in our screenings, all the things we can do. I put this slide together only a week ago, and already within that time, as Rashmi mentioned, the 1B category is now, the CDC is now recommending that be 65 and older and not 75 and older. So to me, what this really points out, though, is the incredible importance of having a county health department, that you can get the specific information for your area and keep referring to it as it's being updated. Because what they're doing is taking all of this information that's at a national level, at a more general level, and they're refining it down to your specific population of people, your specific providers. To give a plug to the DuPage Medical Society, having a group of physicians that meet together to focus on the needs of your community is so important, especially during this time, because like I said, there's been so much variation. Having information that is specific to your area is really essential. And in fact, you notice that I listed the DuPage Health .org website as the place that you really want to get the information, because as Rashmi mentioned, this is set at the national level, ACIP, and then the CDC approves it. That gets distributed, but each state can determine who they're actually going to vaccinate and what the recommendations are. So there's some regional differences to this. So definitely keep up to date with what's going on with the DuPageHealth.org. So what's Walgreens doing is, as has been mentioned, we're involved primarily right now. We have contracts with the health departments across the country to provide vaccines. Us, CVS, and I believe Walmart provide vaccines across the entire country to long-term care facilities. And it's pretty much broken up that each of us are doing about 50% of those, so that we're vaccinating a lot. In our update meeting today, I heard that by the end of the week across the nation, we will have we will have administered over 1 million vaccines, and all of that's in long-term care facilities. So it's exciting to see this begin to roll out and begin to all go into place. Vaccinating in long-term care facilities is a much more complex operation than in the general public, partly because you're going into facilities, partly because, again, each of those facilities vary in how they provide care and so forth. So it's been a very interesting experience, but a very wonderful and rewarding experience to be able to get into these places and really get to the people who have a tremendous need to be protected. So that's what we're currently doing now. We expect that we will have our vaccinations of long-term care facilities completed by January 25th, that we will have been able to fulfill most all of those obligations. We will continue to work with the departments of health because obviously there's going to be ongoing need. But if we can get the bulk of them done here within the next couple of weeks, it's really a significant step forward in protecting this population. The next thing, again, as Rashmi mentioned, is the states are now determining what is the next level of priority groups. How is that going to be administered? Is it going to be, through health systems, through employers, through pharmacies? Now you're starting to look at a much bigger population of people. How can you get through them in a timely manner? So I know that we're working with a number of states of planning how we're going to do that. For example, we have a contract with Disney folks down in Florida. So we're preparing to deliver, I think it's 7,000 vaccines to the Disney employees starting, I think, this week. So there's so many different ways that this is being coordinated together. So definitely stay engaged with the county health department, see how it's going to happen in your state, because I can guarantee you it's going to evolve no matter however they started out. It's going to evolve as they see what's working and what's not working. And then looking into the future, obviously, is looking to the general population. You know, once we get to the general population of how we're going to do that, that's still under a lot of discussion as we're getting experience vaccinating, you know, doing mass vaccinations. We're learning more and more and more about how to do this in many better ways. But as Rashmi mentioned, this is especially preparing your population of people to be prepared for them to know how the information about being vaccinated is so central. You know, one of the things that's been a challenge throughout this pandemic is getting accurate information into the hands of people that they can understand, that they can act on, that they can make their health choices, because more and more they're isolated into their homes. They're having to make a lot of those decisions in their homes. Having, you know, that information come from each of you in many different ways, from your staff, from all of the resources you have, is vital for you know, the public health needs and for the vaccines to be as successful as we'd all like them to be. Rashmi had a great list of resources. I will simplify mine down, but you can see I've actually listed two of the same that she had. So hopefully that will reinforce the idea of how valuable these are. But the CDC has some great vaccine product information. I would definitely recommend, if you have a chance, to take a look through that. Messenger RNA vaccines, it's a new type of technology. It's very interesting, very exciting of how that's being put together. There are some other types of messenger RNA types of delivery in some types of medication. It's something, obviously, because it's been successful here, that will become a mechanism going down the road. So I would really encourage you to take a look a little bit more at that technology. And this site has a lot of information about it. The other piece of it, though, when I touched on a little bit earlier in the is the kind of the checklist of who should get vaccinated, how do you screen for them, all those kinds of things. Again, the CDC has a wonderful vaccination screening form that you can download to walk through a lot of those things. That takes care of, you know, a lot of the healthcare providers. For patients, for the general public, they have to be able to access things that are obviously at a different health education level than you know, the healthcare professionals. On Walgreens.com, we started working many months ago to work with several people throughout the country to help to have some little videos, to have a number of different types of information about several things. So if you just go to Walgreens.com, you'll see this banner. The central block says COVID-19 vaccine information. Just referring your patients to that will help. When they click on that, what they're taken to is a page like this, and it shows some expert insights. So Dr. Paul Offit, who is the head of vaccinology and infectious disease at Children's Hospital of Philadelphia, does a wonderful presentation. Dr. Liana Wen, that you've probably seen on TV speaking, she also does a great a few minutes talking about vaccines, how they work and why people should be involved in it at a very accessible way. People can go through and look at the eligibility. They can sign up similarly to be informed. And then, of course, there's a number of frequently asked questions. The lower part is also some videos that's a combination of various people that we work with a little bit more in the pharmacy industry. So a couple of people that you see there. One is TJ Griffin, who is the Chief Pharmacy Officer for Pharmerica, does a wonderful job of talking about how the vaccines are going to be delivered and some information like that. The lady there is our head of pharmacy, Dr. Rena Shaw, that again really does a great job of talking through a number of different things. These are very, very accessible. Obviously, they're free. They're easy to get to. You can get to them through the Walgreens app. You can get through the Walgreens website. The Walgreens app is the most downloaded healthcare app in the United States. So probably most of your patients actually have it. They can access all of this through that app. So that's, I wanted to make it a little bit more high level and really just refer you to some other kinds of things to take a look at. I wanted to really reinforce, you know, a number of the things that Rashmi has talked about, because I think those things can just, they can't be said enough, and trying to get education out to the public to help them to understand more about this. There's some tremendous resources. The county health department has some, the CDC has some. We at Walgreens are trying to provide it to the communities as well. So thank you for this opportunity to speak to you. And really, I just can't thank you enough for your involvement in this particular organization to improve the health of DuPage County, but specifically of your particular population. Thank you.
Chet, thank you very much. That was a great job and a lot of good information. I'm going to just remind everyone, there's a lot of questions coming in already. And Peggy, I see your questions, so we'll work on that next presentation. But we'll also, please, if you have questions, put them in the Q&A sections. We'll try to get all of them or lump them together. That's some of the common questions. Our last speaker, you know, many of us have known thousands of physicians, but I met Stuart Marcus a few years ago, and not only is he one of the most impressive physician leaders, I could go through his resume of his training at Duke and his surgery in New York and Connecticut, taking care of some of the sickest, most complex patients, and his MBA in Massachusetts. But really, to me, that's not nearly as impressive as what an important physician leader he has become in Illinois. And not only is he one of the, he's a chief medical officer of the largest healthcare providing organizations in Illinois. He is a man who is truly dedicated to bring physicians into leadership role, because I think Stu truly recognized how important it is that physicians be involved in the future of healthcare decisions. And I just have the greatest respect for Stu. And like I said, I could go for a half hour about his resume, but what I've just told you is what makes Stu so important. He is a person who has a really important job, but is really a physician advocate and a promoter of physician leadership. So I asked, when I thought about this, I thought of Stu first and foremost to be part of this conversation. I'm so glad that with Lanny asking him and him agreeing that he is now our last speaker. So Stu, thank you so much for being part of this, and please give us your insight.
Thank you, Rocky. Can you hear me?
We can. You're on.
Great. Well, I appreciate those kind words, and I do have my only disclosures. I am an employee of AMITA Health, and I also consider Rocky a friend. So I just want to disclose that as well. So thank you. Really, I really appreciate those words, Rocky. So for the past year, I've served as the clinical lead, excuse me, of the COVID Incident Command Center. Many of you know that at AMITA, we saw the second patient in the country. It was actually next week will be a year when our patient who had traveled to Wuhan, China, showed up at St. Alexius Medical Center and was the second patient in the country, the first documented transmission when she infected her husband, who was the sixth patient in the country and also was treated at St. Alexius. And that anniversary is coming up, and thinking back on how this has really occupied 70% of my professional life, at least over the past year, is remarkable. If we can go to the next slide. So over that year, I think I want to share with you the AMITA Health COVID dashboard. This is not about vaccines, but I think it's important as you're dealing with your healthcare systems, who are putting needles into arms, that's all being done in the background of a pandemic where, as you know, for those of you who are in the hospitals, there are COVID patients all over the place, and staff is stressed, capacity is stressed, although getting a little better than it was a few weeks ago. But there's a lot of stress in the healthcare systems, and to take on this enormous vaccination effort, I'm partnering with our departments of health, who've been absolutely fabulous partners, is really, I think you need to keep that in mind as you're walking the halls of your hospital. So if you look across the top, you see we've done about 177,000 plus COVID tests. Moving to the middle, 28,134 of those were positive. And that's a positivity rate of 16%. This is over a year. You can see that we've hospitalized about 8,000 patients, 6,768 have been discharged. And unfortunately, we've had just over 1,000 deaths over that time. That's a mortality rate of 3.7%, which we're actually quite proud of, a relatively low percent. Our hospital mortality rate, however, is about 13%, which is coming down as we're getting better at treating the disease. Currently, we have, this is yesterday's dashboard, we have 355 COVID patients in. And if you go down to that large middle graph, the blue line is the daily census of COVID patients that we update daily. And this is readily available to our medical staff on the AMITA Health COVID website. And you can see that the first peak in May, which came down fairly sharply. This peak, which peaked the week before Thanksgiving, is coming down more slow. The slope is not quite, the decline is not quite as steep as we saw in May. But you know, it's very strange to think when we have 355 COVID patients across our system, there's some sense of normalization of that. And it does not feel nearly as stressful as the 600 plus patients we had back around Thanksgiving. The orange line is our PUIs, persons under investigation. And we did have that peak right around Thanksgiving when demand was especially high that outstripped our ability to test. But we can turn around tests right now easily within 18 to 24 hours, which is why that PUI line stays low. So again, this is all in the background of what happened as we started to roll out our vaccines. And if you pay attention to the dates, you'll see what was going on simultaneously, because that peak around Thanksgiving is right as we were preparing to vaccinate. And what we don't hear a lot about, we also established 6 BAM clinics and have infused 150 patients with BAM, which all happened at the same time and doesn't get nearly as much press. So next slide. In late October, early November, we started thinking about how to organize ourselves for vaccination, knowing it was coming. And we stood up our COVID vaccine steering committee, and Dr. Michael Kellerer, who has Dr. Kierkegaard on speed dial, because I know they speak a lot. We appointed him as the lead of the committee, a very experienced chief medical officer. He's currently the chief medical officer for Mercy Medical Center at AMITA. Formerly, he had been the long history as a chief medical officer at Lurie Children's, and we're very lucky to have him as part of our organization. I'm going to go to those colored boxes. We organized ourselves really based on guidance from CDC, IDPH, and the CDPH, and we organized ourselves into 6 work streams. I apologize for the names on here, but you may know some of them. But acquiring the vaccine, and that meant applying, filling out the forms for CDC. Storage and distribution, how are we going to store the ultra code frozen? Where do we have freezers? How are we going to receive the shipments? How are we going to redistribute vaccine among our sites, which proved to be quite a challenge. When we set all this up, we thought we were going to be really dealing mostly with 2 jurisdictions, the Illinois Department of Health and the Chicago Department of Health. Communications, of course, for our associates. The actual administration of vaccine, the conduct of the vaccine clinic from the time a patient or an associate, in our case, comes in to the time they leave. Data integrity, which was all about scheduling, how we were going to document vaccination, our interfaces with iCare, our electronic medical records. That was all quite challenging. And of course, legal and regulatory, where we needed policies, protocols, we need a standing order to give the vaccine, a lot of legal and regulatory considerations, and we had to figure out our consents for the vaccine as well. So this was an enormous amount of work that started November 13th. And if you go to the next slide, there were some early surprises for us. I mentioned that we thought we were going to be dealing with CDPH and IDPH. Now, AMITA is not organized the way the departments of health are organized. We're organized in 3 regions: Chicago Metro, Northwest, South. We also have a behavioral health hospital in our post-acute division. And you can see those are the ministries. We call our hospitals ministries. And you can see that Glen Oaks and Hinsdale are our 2 hospitals in the DuPage County, under the jurisdiction of the DuPage County Health. We do interact with 2 CDC jurisdictions, IDPH and CDPH. They do not do things the same way. There are differences. And we soon learn that we will be developing relationships with 6 departments of health. And we have relationships with all 6 currently. And again, I just want to remark upon our relationship with the DuPage County Health, which has really been fabulous. And we have really worked side by side. And I'm not, I just want to say that I think the flexibility of the Department of Health to work with us has been remarkable. And you've really done a great job. So we really appreciate that. EMS regions, we stretch across 5 EMS regions and 5 regional distribution coordinating centers, which is where the vaccine was initially going. But I believe that some of that has changed since then, when the counties of health started to receive the vaccine and distribute it. So the logistics of large systems, and you know who the large systems that cross counties are, again, something to keep in mind as you're thinking about how your own healthcare systems are handling these vaccinations, because many of the large systems in Illinois stretch across multiple counties. So let's go to the next slide. So this was day 1, and day 1 was at Joliet, and this is the vaccine arriving at Joliet. This was the first day, December 16th. So all this work was done over a month. Vaccine arrived in a thermal container with a police escort through the back entrance of Joliet. And about half hour later, once that vaccine was thawed, Nurse Hannah, who's an ED nurse at Joliet, was the first AMITA associate to receive a vaccine, to a large round of applause. It was really an incredible moment to see the needle getting into the arm, and it's been pretty much nonstop since then. Next slide. So we started our Pfizer Blitz. We had 15 administration sites, the same hospitals listed down the left of this table, and we set up clinics ranging from 4 to 6 hours across multiple days. The light blue were dose 1, and we knew that 21 days later, everyone would be coming back for dose 2. So we established the clinics for dose 2. The scheduling system we used, we stood up on the fly, did not work perfectly by any stretch of the imagination. And for anyone thinking about doing this, the ability to schedule patients or associates or patients into these mass vaccination clinics is quite a challenge. We were scheduling half-hour, 10 patients into a half-hour block. We've done a lot better than that. We're now down to, we can schedule a patient a minute, but we do that in blocks. But we can, in a 4-hour time slot with 3 vaccinators, we can process about 250 vaccines. And those numbers are important to keep in mind as we set our goals, because we do have a goal at AMITA of getting to 1,000 vaccinations a day across our system. So this Blitz, by the way, finished about 48 hours ago. You can see that all the way on the right, that's January 11th. And that was when we still have 85 patients that we're chasing down. I keep saying patients, but they really are employees or other healthcare workers in the community that we are still chasing down to come back for their second dose. Most of them are coming back, but some of them are decided that they were going to forego the second dose for one reason or another. Again, something, a challenge for us is contacting these associates to bring them back. And now we're in a phase where we're using Pfizer vaccine and Moderna vaccine, and we have to be very careful that we don't mix things up And you can imagine how easy it is to make an error where somebody got one vaccine as dose 1 and the other vaccine as dose 2, and that is not something that we want to do. Next slide. So this is how we did. We vaccinated over 15,000 associates with dose 1. It became challenging when about a day or two into this, we thought we were going to get 5 doses per vaccine, and that became 6. And I'm sure from the Department of Health that wreaked havoc with your tracking systems. It certainly did with ours, but it really threw off a lot of the numbers with that 6th dose. So it turned out we were able to vaccinate more people than we thought we were based on the number of vials that we had. You can see that we vaccinated the most at St. Alexius, close to 4,000. And for the 2 DuPage County hospitals, Hinsdale and Glen Oaks, we vaccinated about 5,000 doses. That would be 2,500 people between them. Go on to the next slide. So getting a little practical, what did we learn? So one things that worked well is we received enough vaccine in week 1. We knew that we were going to be able to vaccinate over 15,000 people. We have at AMITA about all in, including our doctors and everyone affiliated with us, we have about 30,000 people. We knew from pre-vaccine surveys that about 50% would be accepting the vaccine. So we felt this was a good number for us. So we feel now we have vaccinated most of our frontline workers, and we are certainly extending into other healthcare workers, as well as healthcare workers who are not necessarily AMITA employees or affiliated with AMITA, dentists, chiropractors, other healthcare workers, community workers that are in the community. So that's been a big positive. We expect additional supply to vaccinate remaining associates. We still have a fairly large demand, and I think as time is going by, more people are accepting the vaccine, although we really haven't had time to sit down and start to dig into the people who aren't accepting it to learn why, or to learn about any of the profiles of those people, specifically about race and ethnicity, to see if there are differences that we're seeing in our system. We had very few adverse events. I think Rashmi talked about the adverse event reporting system. I've talked to people, my own colleagues who've had adverse events that aren't reporting them, and because they just think, I guess as healthcare workers, we feel we're just having an adverse event maybe is just part of our daily routine, particularly for doctors who often have a history of going to work ill. So we do have 49 that were reported after the first dose and 6 after the second dose. We've had 0 hospitalizations, maybe about 10 people were sent to the emergency room, but all have resolved. We're not aware of any serious adverse events in the 15,000 that we vaccinated. But I've talked to people who've had lymphadenopathy, chills, and I've encouraged them to report, and they, for whatever reason, don't necessarily think they need to, but we of course encourage them to. And we've had a highly efficient administration. We had no real waste, and our goal was to use all our vaccine. So challenges, well, we talked about the coordinated between the 2 CDC jurisdictions, 6 county healths, and 4 regional coordinating centers has proven complex, but we think we got it. There was short notice of delivery times, and sometimes the vaccine doesn't come as planned. We actually had an incident last week where dose 2 at a particular county, not DuPage County, the order was not put in, the vaccine was not delivered. And my understanding is that DuPage County helped us out by providing some vaccine until that other vaccine came in. And again, we appreciate that collaboration, but those are the type of things that can go wrong, and nobody's fault. It's just what happens when you're doing a large initiative like this. Thawed vaccine came as a surprise to us. We were prepared for frozen vaccine. We have the ability to store frozen vaccine. The vaccine, about 70% of our vaccine was delivered thawed, which means we had to use it within 4 to 5 days. And so that's how come we had to scramble to vaccinate that many people in such a short time, where we thought we were going to have a little bit more time, but we're expecting frozen vaccine going forward. I mentioned our scheduling tool. We built it. It was a radiology scheduling tool that we turned into a vaccine scheduling tool. Its performance was suboptimal, and we're looking to use something different in the next phase. And a big thing that we're experiencing is staff fatigue for vaccinators to be putting needles into arms for 12 hours a day, for the people who are registering the patients, for all the people who are showing up without appointments, who just want to get in to get a vaccine. It has caused a lot of fatigue among our staff. We do have security at our vaccination sites, but if anybody is planning on standing up these sites, be ready for an onslaught of people who are looking to be vaccinated once the word gets out, and how you handle that, especially as the staff gets more and more fatigued. Confrontations can no doubt erupt, and they have. But fortunately, there's been no serious events from that, but truly our staff need a break, or we need to expand our staff who are manning these clinics so that we can keep going. So last slide, one more. So looking forward, we need to prepare for mass vaccination. We need to reorganize ourselves as we move away from our employees and we start to move into additional healthcare workers, but more importantly to our patients and our communities. And once we start moving into our patients and our communities, things change a little bit. The way we document changes and some of the things we have to do. So these are the work streams that are being established actually this week and we're moving forward with. So registration and billing. You can't bill for the vaccine itself, but you can bill for administration. And it's a nominal payment, I believe, of $16 for dose 1 and $30 for dose 2. It will help offset some of the cost, but we do need the ability to register patients. Patients will not be billed, by the way. These are either insurance companies or CMS. And we have to have the ability to register patients and obviously to bill them. Data integrity, our scheduling solutions, ordering, documentation, how we integrate with our EHRs. Pure OHS is our associated health EHR, but now that we're moving into the public, from a hospital perspective, we have to document vaccines in our EHRs, and that's a CMS condition of participation. And of course, we have to monitor, track, and report. Planning, we have to figure out, we want to start to decentralize our operations and start to think more about how we handle flu vaccines so that a year from now, this becomes somewhat part of our normal operations because we don't feel that this is going away anytime soon. We have to figure out what sites we want to vaccinate in. And of course, we want our patients to come back for dose 2, which is maybe a little bit more challenging than getting our associates to come back for dose 2. And of course, we want our patients to have a good experience. I am happy to say that once you got into the clinic and it went through, we did receive a lot of positive comments about the flow and the smoothness of the vaccine clinics, which was good. Equitable distribution, we have a significant interest in making sure that our vaccine gets into the Black and brown population and those who are most vulnerable. That's part of our mission at AMITA Health. And it's something that I think this whole pandemic has really brought to life. So we have a specific committee named Equitable Distribution, so we keep this top of mind. And it is, again, something we pay a lot of attention to. Legal regulatory continues. The vaccine administration, which is, again, the actual running of the clinic itself, continues. And of course, communications. So a lot of what you see here really carries over from our initial work streams, but we do have to pivot and change things as we move away from healthcare workers to the community. And that's the challenge we face right now, all in the background of 355 COVID patients in our hospitals, plus all the other patients that are jamming our ICUs and our floors, just like all the hospitals in the area. So I would like to thank you for the opportunity to share our work with you. And Rocky, I'll turn it back to you.
Well, great, Stu. That was wonderful. Great presentation. And I think what our 3 speakers are saying is this is just easy peasy. There's no issues at all with this. I'm just kidding. Obviously, this has been a heroic logistical feat. I mean, I think we all should feel very fortunate we have such really important leaders in DuPage that have been really helping this. So I'm going to say a couple of things. We've had a bunch of questions. Rashmi has been my hero. She's been answering a lot of them online. Some of them fall into sort of general categories, and I'll try to ask our three speakers to address them. And if you don't feel you have more questions, please let us know. Kate, I don't know if you can do this. If you can post a link that people need to go to get to the CME. Please, I hope all of you physicians that are on this call, please get your CME. You've earned it. It's I think we've all learned a lot from our three friends here tonight, and you should absolutely get that. And I want to thank AMITA again for making the CME possible. So as I said earlier, I think Rosh has been asking a lot of these questions, but they sort of fall into broad categories. And maybe the first one is, I guess, each of you represent different components of healthcare in DuPage, but maybe each of you did take this question. But in general, as we get to next patients, our older patients that are going to be in Tier 1B and even 1C, how would each of you say they should look at each of your institutions on how to get the vaccine? I'll start. Rashmi, you go first, and how the DuPage County Medical Health Department they go through you guys. I know you've listed some links, but what's your anticipation time frame and how they should take advantage of our great health department?
Sure. Thank you for the question. And so basically, the timeline, it's a little fluid just because there are so many variables, including vaccine supply and vaccination capacity and demand. Right now, I would say demand is high. So that's one constant, which is good. We want people to want the vaccine and want them to get vaccinated. So we anticipate phase 1A lasting about 6 to 8 weeks. And then as we reach, that 60 to 70% completion of healthcare personnel being vaccinated, then we anticipate opening it up to phase 1B, which is exponentially larger of a population size. It's about 5 times the population size for phase 1A. But so we anticipate it taking longer. At this point, we're anticipating probably at least 12 weeks. But we also anticipate having much expanded vaccination capacity in the community. We've been hearing of federal, partnerships in being negotiated, as well as, with the large pharmaceutical or large pharmacy chains, and also at the state level and even locally, we're reaching out and have been successful in engaging some local pharmacies to begin providing vaccination clinics. So that's about as far as I can anticipate, because it would be only then after. So I would say hopefully by early mid-February, we'll be transitioning, or at least beginning phase 1B. And then that'll likely take us through February, March, April. So hopefully by May, we'll be looking at beginning phase 1C. But again, it's very fluid and, like I said, with a lot of variables in play. That would be my estimate. And I'll turn it over to the other esteemed panelists.
Since you're leading the largest healthcare network in Illinois, how I'm sure this would be very similar with Advocate and AMITA, or Advocate and Northwestern. But how do you see the next few months and how we can interact with your hospitals and the healthcare providers in AMITA to get their vaccine, or how they look as a resource?
Sure. Well, we consider ourselves an arm of the Department of Public Health. So we certainly follow the Department of Public Health's lead as to the plan, because as I've learned, as I've gone through this experience, there is a plan, and there is the CDC and the Departments of Public Health do have a plan of partnering with various entities to distribute vaccine to discrete populations. And that's important, I think, to think of the world in a public health way and not necessarily in a hospital way, where we tend to think of our patients and those patients who, are ours. So, but on the other hand, those patients are the ones we know the most about. We know how old they are. We know how to contact them. We know their comorbidities. We have all their information in our EMRs. So we're thinking about the next phase in 3 groups. One, the biggest group, because it's over age 65, and we think about the Medicare population, specifically those who are in our attributable lives in our accountable care organization or in our clinically integrated network. Again, those patients are risk stratified. They have RAF scores. We know who the highest risk and the lowest risk are. So we can prioritize those patients. And again, we know who they are, where they live, and how to reach them. And they have doctors in our system. So that's a fairly straightforward one to reach. Then we have the group that's maybe not attributable to us, but they've had AMITA connections at some point. They've been in our hospitals. We have information in our EMRs. That's the second bucket. And then the third bucket for us is the community who have no connection to AMITA at all, have never been at an AMITA site. We don't have any information about them in our electronic medical records. And that's where we just open up public clinics and people volunteer really to come in. And I think that's the hardest population to reach, and may, from a healthcare system, may cause some controversy, because I think from a public health point of view, those populations are the same. They're over 65 and they have comorbidities. But from a healthcare system point of view, we have to think about our doctors and their patients. And I can tell you already, our doctors want to vaccinate their patients. And so we have to figure that out about how those two worlds come together.
Great. So, Chat, you're representing one of the largest pharmaceutical, let's say, pharmacy companies. What are your thoughts on answering that question?
Well, I enjoyed Stu's comments, because it's going to take all of us. The number of people that have to be vaccinated, every different way that we can do it, having the health systems, do as many of the people that they can reach in any way that they can. I know that we have contracts with several different states, each of them wanting us to do different things. Some of them providing obviously some vaccines in our stores, some of them in large public settings, some of them where our pharmacists wouldn't actually be doing the administration. They would just be drawing it all up so that you can have other people do the vaccine to make it be more efficient. It's going to take all of that. It's going to take every different way that you can imagine to try and deliver this to be able to cover it. I think one of the biggest things is how do you maintain the safety when you have so many different delivery systems? How do you keep people safe when they're in those various situations? There's lots of good guidance to be able to do that. So I think it's going to be really important to continue to monitor that as we go forward. But it's a challenge getting the vaccine out to all of these different places. But that's what we're going to do. So we're looking at it in just about every conceivable way that we could imagine being able to provide this. And like you're saying too, we're also looking already towards next fall and winter, is how do you make this then part of your ongoing immunization program.
Right. Well, thank you, Chet. So, like I said, there have been a lot of questions. I guess timeline. I think, Rashmi, you said, like you said, it's fluid, but hopefully February, late February, we'll be well into phase 1B. And yeah, are you wary of talking about 1C and the general population? What time frame what do you, from your perspective right now?
I'd say, I think late spring is reasonable to anticipate. Again, cautiously optimistic, and then hopefully phase 2 by, summer.
Okay. So another one I'll ask, I guess I'll ask all of you this. Please feel free. If someone texts me personally, says, if I've received the vaccine, but I'm exposed to COVID patients, which I imagine there'll be first line people, is it still possible for me to give the vaccine to other people? That's a question. That's a good question. I don't, Rashmi or Any one of the three of you want to give an answer to that? I don't know that we know for sure, do we?
So I think if I understood it correctly, if someone is a close contact, meaning if someone is, had a, breach in their PPE and had an exposure to a person infected with COVID-19, then they themselves should be in quarantine. So basically someone who's in quarantine should not be providing care in most circumstances.
I guess there is
or should be vaccinated. Go
So
ahead, sorry.
maybe I misspoke. This person is implying that they're a healthcare provider. They've received both vaccines.
Oh, I got it.
They're still exposed to COVID patients, but is there a risk? I mean, I don't know if we know the answer to this. Maybe you do, but are they still a risk of coming home and giving it to their families or loved ones?
Possibly, we don't know yet, basically.
Right.
So we still recommend all the same infection prevention measures, including personal protective equipment and, universal masking and all, until we have more specific recommendations in the coming months. Yes, exactly.
Chet, do you agree with that?
Yeah, very much so. We have 70,000 people in our company that are providing vaccinations, and so we have to watch very carefully how we protect our team members as they're doing this. And Rashmi, I agree with 100%. The vaccine will help. There's no question. We all know vaccines are not 100% effective. We don't yet know to what degree can you be an asymptomatic carrier, even if you've been vaccinated. We don't know that yet. And until we have a better understanding of that, all of the precautions that help to protect need to be in place. The other piece too is there's really clear guidance for people that are doing immunizations of the appropriate PPE to wear so they can protect themselves, just like we've done with lab testing, similar thing as we do vaccinations. And when people wear the appropriate PPE and follow the guidance, the rate of transmission is extremely low. We obviously track that very closely within our team member population. And we don't find that there's any larger amount of disease in the people participating in these as in our general team members.
Stu, you agree?
Yeah, I agree with that. You should ask me that question about a week. I'll tell you a little personal experience. So I've received the vaccine. My second dose was just 2 or 3 days ago. Today, my 22-year-old son, who's home with us for a little while, called me and said he lost his ability to taste.
Oh boy.
And got tested, and of course he's positive, he's asymptomatic. And so I am now going to quarantine myself with him for 2 weeks, and of course I'll get tested in a few days. So I may be a living example to answer that question.
Well, I almost want to come over and visit your son just so I can get off call. No, just kidding. Just kidding. No, of course not. Of course not. A couple other questions. Again, there several people are asking about if they're not directly or have a tight affiliation with a healthcare network or a hospital, they're independent and truly don't have privileges to a health. How, Rashmi, it sounds like you'd be a great resource to go to on your website to see how they can do it. Even though they're frontline workers, they can't just go to the hospital. Is that what you suggest they do?
Yeah, I mean, more and more of our hospitals and health systems either have been or are opening up their capacity now that they're getting through their own on-site and connected healthcare personnel. So that's extremely helpful to have additional sites opening up to community or non-affiliated healthcare personnel. But yes, certainly at the health department, again, we're currently able to vaccinate about 300 individuals a day, and we've just this week started our second doses, so we've expanded beyond that when you count second doses. So it's a lot, but it's limited when we look at the thousands of individuals who need and thankfully want to be vaccinated. So I think the health department, as well as now pharmacy sites in other community and health system-based clinics, and then hopefully more and more community providers and clinics and practice sites will be offering the vaccine as well. So keep checking and please do, like you said, we are asking that folks sign up to for our newsletter and then we'll send out information based on the sector role that they select, particularly in healthcare in this case.
Well, yeah, that leads into the questions, but you sort of answered the question other people have about how they could become a site to be an immunization site. Sounds like they could work with you directly, and over the next few months, maybe be able to be an immunization site as well.
Yeah, and I wanted to share that. So the Illinois Department of Public Health we thought it might be out already, but this week we anticipate a siren, which is their kind of, health alert, that'll be coming out. So as soon as that is issued, we'll share it with Kirk McMurray and Kate and have it widely disseminated through DuPage County, through the DuPage County Medical Society listserv. Thanks.
And Chet, just going to ask you, there are a couple questions came up about healthcare facilities, nursing homes, extended care facilities. Will Walgreens be working with those sites? Do they request Walgreens or CVS to maybe come and have a dedicated program at a healthcare facility where people at risk are living, whether it could be nursing home or it could be other healthcare providing facilities? Is that something that is on the table for Walgreens?
It is, but with a bit of a caveat. So we have to contract with each of these. There was a sign-up period to contract, and they could choose one of the three of us of who they would want to come in to do this. I believe that they can still do that. I don't think that we can contract directly with the facility. They have to go through HHS, I believe, or the health department to do that contracting. But we're happy to do it, but there's a contracting. I don't know all the details of that.
Sure. So there's a question that keeps coming up, and I think it's just a paraphrase, a recurring question. I guess the best way, and maybe you can comment, the best way for people who are maybe 1B or 1C to find out when they can get a vaccine would be to contact their local hospital, their health department, or even their hospital or physician they work with. That they'll be the best one. I mean, for I guess I'll ask each of you. So Stu, what's the best way for a AMITA patient to find out when they'll be up to get their vaccine? What would you say this is the best way to get the information they want?
Yeah, that's a difficult question. We again we're waiting to open up, following the lead to the Department of Health to have patients. There's so many people who are interested. Sure. It's having the resources to be able to answer phones and email people back, whatever. That's a challenge for people to call a place or email a place to get a response, a personal response. I think we have to work on our communication, which is why we have a communication work stream of how we communicate to the public so that they are all getting the same information. But of course, we know there's variability in how people interpret that information. That's a tough.
Of course, yeah, tough problem, right?
Yep.
So I imagine, Rashmi, I imagine for you it's the website, and you'll be posting almost daily updates on what's going on for vaccine in the health department.
Yes, at least weekly, and sometimes more frequently than that as there are developments.
And Chet, same for you. Your website, that app that you talked about, would that be the best way to go for Walgreens?
Yeah, ours is more towards education. I think there's some great education. We direct people actually to their county health department's website. So DuPage.org is really the very best place to get the information, because every single county is different, and we can't keep up with that. So we do lots of general education, and then we direct everybody to the county health department.
Okay. So I tell you, first of all, on the screen, if you have the screen up again, to get your CME, all those physicians on here, get your CME credit, that's SurveyMonkey. You can go to that, or use your smartphone and click that image, and it'll go right to the SurveyMonkey. You can enter the questions, answer. Please say nice thing about the moderator. My mother reads all the comments, but also, but please, I can't tell you how much we appreciate our three physician leaders. They're not only thank you for taking the time tonight, but just thank you for everything you're doing to help all the patients we care for. Again, this will be up on our website, oh boy, Kurt's gonna kill me, dcms.org. You can go online and you can see this. We'll also have many of the links that Chet and Rashmi and Stu had in their talks, so you can click directly to get information that you might want. And again, please click. And if you're interested, if you're a physician, we would love to have you become involved and be part of this organization. It has a long and great history that we're all proud of, and we'd love to have you be part of that proud legacy. On behalf of the DuPage County Medical Society, thank you for everyone coming, but especially thank you for our 3 outstanding speakers. We will be having future programs. Please keep informed and watch out for emails that come out, but we'd love to keep having you be involved. And again, Stu, Rashmi, and Chet, great presentation. Thank you so much on behalf of all of us.
Thank you, Rocky.
Thank you.
Thank you, friends. Okay, everyone, thank you. Have a good night and Happy New Year.
Thanks, everybody.